Hi everyone, my name is Sophia. My group partners are Katie and Joe. We will be talking about staying safe and independent, community mobility, and driving for older adults. So, community mobility includes how people move around their environment to do daily tasks like grocery shopping or seeing friends. For older adults, it is a major part of independence and identity. Occupational therapists help maintain this safely using adaptations or alternative ones needed. This quote, driving restriction is associated with increased rate of depression, poor general health, and decreased participation in the community. It is by Schultz Krohn, shows how losing the ability to drive can impact their health and well being. So, when we talk about consumers of a community mobility service, we're referring primarily to adults aged 55 and older. These individuals may still be working or newly retired, and many live independently. For them, driving is more than just transportation, it's a part of their lifestyle and personal identity. Families also play a major role either by offering rides, helping with transportation decisions, or providing emotional support. One article states older adults value driving their personal vehicles in order to maintain their lifestyle and independent mobility. This quote is also by Schultz Krohn. As OTs and OTAs, we work not only with older adults but with their families. We help them plan for safe mobility, explore alternatives, and support the emotional and social impacts of changing driving habits. Older adults face a variety of challenges that can affect community mobility. Physically, natural changes like vision loss, hearing loss, slower reaction time, and chronic health issues can make driving more difficult or unsafe. Socially and emotionally, stopping or reducing driving can feel like losing a piece of their identity. It's been linked to depression, anxiety, and isolation. Schultz Krohn and colleagues explain that self restricting driving behaviors reported by older adults may contribute to the social isolation experienced by their population. On top of that, environmental factors can create barriers. Many communities lack accessibility or desirable public transportation. Even when options exist, older adults may not find them safe or appealing. The study notes that even when transportation options are available, they were not preferred compared to driving oneself. A quote also by Schultz Krohn. Occupational therapists and OTAs address all these factors, physical, emotional, and environmental, when designing interventions to support older adults in staying active and connected.
Now, to go into more specifics on why driving and community mobility relate to OT and why an OT would be one of the individuals helping the client would be because driving and community mobility relate heavily to OT for many different reasons. Some of those reasons are that occupational therapy is a very holistic practice, meaning that the whole point is to look at the whole individual. We could go about this by looking at the whole individual's daily routines and occupations, which are usually what tends to be meaningful to the individual. The OTR focuses on evaluating the patient, and the OTAs work in collaboration with their OT supervisor to provide the direct service to the client. In specificity to driving and community mobility, it is considered an IADL according to the AOTA, meaning that it isn't necessary to survival, but it is important to get around and participate in social interactions and community participation. Driving and community mobility is a cultural expectation, meaning that many individuals are expected to get around by themselves once they are an adult. Therefore, when someone can no longer drive safely or at all due to an ailment or an injury, or even, as we're talking about now, the aging process, this could cause the client to no longer be a part of society as they once were, possibly causing things like psychosocial effects or the individual's health to further decline because of less functional mobility around the community, which really is a big factor for the aging adult. Now, to dive even deeper of the role of the OT in driving and community mobility is for the OT to aid the client in becoming independent where they may have lost it. For example, there are many different intervention techniques. If a client has broken a leg and has a boot on there, but they're expected to fully recover, the best bet may be to establish or restore these past skills. However, this could also look like the OTA working on strengthening the foot muscles or working on relearning how to use the foot once the recovery time frame is reached. However, the OT could also use the modify approach, meaning that if someone gets a leg amputated because of an accident, there will need to be compensatory techniques. For example, the OTA could give all hand controls to the client, or they could find new modes of transportation if the car is too much of a risk in the long run or the client's insurance does not cover the adaptive equipment needed. For aging adults, these issues could be a diagnosis of hearing loss or vision loss, but this could also be a diagnosis of dementia. For example, dementia could cause you to lose your executive functioning, meaning that higher level cognition is really needed for driving. And so if that is taken away from the client, they may no longer be able to drive safely and efficiently. A lot of times as one ages, the aging adult will not be able to recover, and the therapist will need to utilize the modify approach. Health literacy and occupational justice are very relevant to the aging adult because of the stigmatization surrounding older individuals. As one ages into their older years, young, old, middle old, and old, the older adult is seen as someone who becomes less independent and relies either on their children, spouse, or a caregiver. However, even if this is the case, these older adults still have their rights, and their independence is still very important for themselves and for their individuals around them. Both of these important factors are very similar in the fact that they both want the individual to have their rights and that the equality is embedded within, meaning occupational justice and health literacy. Health literacy is the idea that someone should be able to be provided with the most relevant information to make the best informed decision about their health. For example, if a doctor or healthcare professional gives a suggestion of a procedure, the patient should know all the information so that they feel comfortable and fully informed to make the decision. Occupational justice, on the other hand, is the idea that no matter the person or their age, they should be able to complete the occupations they find meaningful and purposeful. This means that there should always be some way to gain some level of independence no matter the diagnosis, injury, or ailment. For example, if the aging adult is showing mild signs of forgetfulness, a visual schedule could be made to aid in remembering. Or if the aging adult has a hard time seeing, different tactile suggestions could be made, or bolded fonts on papers can be given. This not only increases health literacy, but it also increases occupational justice for the aging adult. The reason the OTA becomes involved in the area of driving, rehab, and community mobility is to help the client maintain or improve their independence through their recovery or acceptance of an injury or chronic condition. A lot of times, even without an abnormal diagnosis, aging adult bodies change, making it unsafe to drive or walk for long periods of time. For example, as someone ages, their night vision and their ability to react as fast becomes negatively impacted, causing driving to become unsafe. Therefore, the OTA could find easier routes for the client to take or have them make a schedule that involves only day driving. However, if the individual can no longer walk as well because of low muscle tone or weakness, either an adaptive car, a four-wheeled walker, or an adaptive bus could be the intervention utilized for the patient. This would be to maintain and improve their independence overall, which is the goal of OT in an aging adult's driving and community mobility interventions?
OTAs can provide safety tips and modifications in the client's car to ensure that aging adults who are independent with self driving can navigate throughout their community. Some tips to enhance their safety can include recommending that they are at least 10 inches away from the steering wheel to ensure that the airbag can properly deploy, reducing the injury in case of collision. By adjusting the route they take and at the time of day, OTAs can create a less stressful environment for the clients to significantly lower their crash exposure. OTAs can improve the client's awareness of the surrounding vehicle by reminding and/or role-playing with the client to regularly check and adjust mirrors to minimize blind spots. Periodic vision cognition, and motor skill assessments can be issued by OTAs to identify any changes to aging adults that may affect their driving ability before it becomes hazardous. Lastly, OTAs can recommend the use of adaptive equipment such as steering wheel covers and pedal extenders to compensate for physical limitations and create a safe experience to those who are able to self-drive. There are many alternatives for aging adults who are no longer able to self-drive to still participate in things they want to do. Some alternatives may include using public transportation such as buses, trains, subways, and ride-sharing programs. As OTAs, we can guide and ensure that aging adults are able to independently use these alternatives so they don't become isolated away from engaging within their community. For those who don't live in a rural area, aging adults have the opportunity to access and participate in walkable communities. Even though they may not be physically or cognitively capable to operate a personal vehicle, this is still an alternative for them to do things they enjoy and need to do. Discussing with their family or caretakers can serve as a step towards them maintaining social and community engagement. Family and caretakers can help older adults feel more supported by initiating open conversation and focusing on concerns rather than demands. They can help them plan routes, schedule rides, or even accompany them on their trips so they can feel more comfortable and build confidence with alternative transportation. OTAs can collaborate with the family/caretakers to identify warning signs that the client is unsafe to drive, such as delayed reaction times or getting lost or confused in familiar areas. We can also work with them to create a driving retirement plan. This plan can include timelines, transportation alternatives, and strategies to ensure they can maintain their independence and social connections.